Michael, and this is California. And in our offices, we see hundreds of Medicare clients a year. And the Medicare program, being complicated and somewhat Byzantine, lends itself to being mysterious, misunderstood, and easy to make assumptions about. And these assumptions oftentimes are based on something that someone hears from a friend or from a website or even from the TV or radio. But it leads a lot of people to make some pretty big mistakes with regards to their Medicare. And some of these mistakes can be as minor as paying a bit more for your medication, or can be as big as changing your total premiums over your total lifetime. So today we're going to talk about the 5 mistakes that folks often make with their Medicare and how those can be avoided. Now before we do that, if you like this information, if you find it interesting, if you find it helpful, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Thinking that Medicare is free. So this is the first common mistake that we get from a lot of our clients. And it would totally make sense to think that Medicare should be free. Because if you look at your paycheck from every month of all the months that you ever worked, you can see that a lot of money in fact, had been taken out to pay for Medicare. But the reality is that the money actually only serves to cover a part of your Medicare costs. And that's your Medicare Part A portion, which is for hospitalization. And the Medicare Part B portion, which is for your day-to-day medical services, is usually not going to be covered by any of the deductions that you paid into it over the entirety of your lifetime. And for example, in 2020, the monthly cost for Part B is $144.60. Also, there's a Part D, which is for your Medicare prescription drug coverage, which is also not included in those deductions. And that one costs around $40 a month. Now, both of these usually need to be paid for on a month-to-month basis to ensure that you have full coverage that you need to cover your health services. Thinking that Medicare will pay all of your healthcare costs. Now, this is another one that seems pretty counterintuitive, since someone is paid into Medicare system for maybe 10, 20, even 40 years. And in addition to that, they're paying $144.60, as well as $40 for Part D prescription drug coverage. That should be enough to pay in to cover all of your healthcare costs, right? Well, again, Medicare doesn't cover everything, and in fact, they have set co-pays and co-insurance, and in general will only cover 80% of your healthcare costs. It's excluding any drug prescription coverage, as well as the 80% means that you're responsible for 20% of your healthcare costs. So unlike the under 65 plans, there's no limit to how much someone can end up paying for their healthcare costs on Medicare. So that means that on Medicare, since you're responsible for 20%, you have to pay 20% of the bill. So whether it's a $100 bill or whether it's a $100,000 bill, you're responsible for 20%. And that can end up being a lot of money. So either way, thinking that Medicare will cover all your costs ends up being a very expensive mistake if you have any major health issues and don't have any supplemental Medicare coverage. Not applying for Medicare Part B. So Medicare Part A and Part B are what make up what's called Original Medicare. It's something that people will usually get enrolled into automatically once they become eligible for Medicare. Now Part A, again, doesn't usually have a cost to it because it's something that's been paid into all those years when somebody was working. But Part B, on the other hand, does have a monthly premium of $144.60. And this leads a lot of our clients, or at least some of our clients, to think that they should avoid paying the $144.60 by just not taking Part B or for canceling their Part B. And this is usually a very, very bad idea, because it ends up being penny wise and pound foolish in many cases. And there's a couple reasons why this is a bad idea. First is because if you don't get Part B when you're initially eligible, you'll not be able to get it back until July of the next year. And a lot of things can happen between now and July. And if something does happen, it means you won't be able to get any health coverage for your day-to-day services until you get enrolled in your Part B plan by July. Second is that there is a penalty for waiting to apply for Medicare Part B. So if you don't have other credible coverage, so something like through your work or health insurance through the VA or maybe through a spouse's work, there is a penalty that will grow every single month that you don't have Medicare Part B, but you could have been enrolled into it. Additionally, this penalty will be added on top of the current Medicare Part B price. So for example, if you waited a year to get Medicare Part B and the penalty grew $1 per month that you didn't have it, it would mean that for the next year, if you enrolled in Medicare Part B, and then you'd have to pay the $144.60 as well as the additional $12 for the 12 months that you didn't have the Part B as a penalty. That would come out to $156.60. In addition, that would mean that $12 would be added on to your premium, whatever that is, for the rest of your life. And that could potentially mean thousands of dollars over a lifetime. Assuming you don't qualify for help through any program that assists people paying for some or most of their Medicare costs. So many people assume that they're actually not eligible for help paying for any of their Medicare costs. But actually, it is possible that you might be eligible for some of the different programs that help with things like paying for monthly premiums, paying for prescription drug costs, or even paying for co-pays or co-insurances for your Medicare plan. And the income guidelines on some of these programs are actually really generous. And Medicaid and Medi-Cal, it is definitely one option for folks, but it's not the only option out there. There are programs like Low Income Subsidy, or LIS, which helps pay for your drug prescription costs. There's other programs like MSP, which is called the Medicare Savings Programs, will help you with your Medicare costs. And also, many drug companies offer discounts and coupons for some of their most popular prescription drugs. Also, these programs, they typically have a different and much higher requirement than Medicaid and don't usually require you to spend down your assets to be eligible for the program. So, if you think that you might be eligible for any of these programs, you should look into the Low Income Subsidy Program, which is offered through Social Security directly, the Medicare Savings Program, which is offered through your local county, or even talk to your drug maker to see if they have any discounts or coupons for the drugs that you are taking to help you pay for those costs. Missing the initial enrollment period when turning 65. So Medicare, it runs on a very specific time frames. And the first one is that everyone gets something called the initial coverage election period, which is a 7-month window that people have to enroll into Medicare. And it starts 3 months before your 65th birthday. It counts the month of your 65th birthday, and then 3 more months after when you're able to apply. So it's a total of 7 months. And at any time during this 7 months, you're able to enroll into your Medicare plan. But you'll only have one chance to do it. And in fact, if you miss that enrollment window, you're not going to be able to re-enroll until January of the next year. So if you are near your 65th birthday, you should be keeping an eye out for that Medicare card to come in the mail. But if you don't get automatically enrolled, you need to actively apply for your Medicare within those 7 months around your birthday to ensure that you don't miss your initial coverage election period and you don't have to wait a year to get your Medicare coverage, as well as face any sort of penalties that happen as a result of not getting enrolled when you're initially eligible for Medicare. Thank you so much for watching our video, and I hope that you found it interesting, helpful, or at least useful. And if you did, please don't forget to like and subscribe. That way you can get updates when our newest and most informative videos become available. Also, if you have any comments or questions, we love to see your comments and questions. Leave those down below. We'll be happy to make a new video or a new post as soon as we can. Now finally, we here at California, we know health insurance. So whether it's private health insurance or Covered California or Medicare or Medicaid or Medi-Cal or even health insurance for a small group, we know health insurance, because we all know it can be very complicated coming out of your work insurance and going on to private health insurance. Or maybe you're turning 65, trying to figure out which Medicare options best fits your needs as well as your budget. Or maybe even you're losing a program like Medicaid or Medi-Cal and you have to find health insurance on the private side. We can help you walk you through that whole process and figure out which plans are best for you. So if you have any questions about your healthcare, leave those down below. We'll be happy to make a new video or post for those as well. Now, other than that, I am Michael, and this is California, wishing you a happy, healthy day.